Hi everyone, this is Sean with the MassSupport Network here with your COVID-19 update for Friday, December 18th, 2020. So around the world and here at home, things are still increasing, but perhaps slightly plateauing in terms of case counts. We crossed 75 million new cases worldwide in the last week with an increase of about 4.8 million new cases in the last week, which is about 300,000 cases more than the week before. Here in the United States, we saw an increase of about 1.5 million new cases since last Friday, about 100,000 more than the week before. And here in Massachusetts, we saw 35,000 additional COVID-19 cases. That's only about 1,000 cases more than it was the week before. So compared to the spikes over recent weeks, this is more or less holding steady, but again, holding steady at this rate is not a good thing. When it comes to deaths, again, things are more or less on an even keel there. Worldwide, we saw 80,000 deaths in the last week, only about 1,000 more than the week before. Again, 80,000 deaths a week is not good. Here in the United States, we saw 18,000, which is about up 2,000 more, so still increasing there. And in Massachusetts, we saw 349 residents of the Commonwealth die of COVID-19, which is 14 more than the week previous. This graphically, we did hit some record highs in terms of case counts yesterday and the day before yesterday as well. Hospitalizations, of course, are continuing to break records every day, as there's not really any end immediately in sight there. And the highest ever day for deaths was just on Wednesday, and our 7-day average of deaths is, of course, the highest it's ever been, far exceeding what it was back in April, which is previously the worst time in the pandemic for deaths. In terms of cases, when looking across the country by census region, right now, the Midwest does appear to be trailing off, fortunately, from its intense high last month. However, that means that every other region is now passing it in terms of cases by million people. Now, of course, this is by population, and the Midwest is a relatively small region. It means that the West and South are already well beyond that in terms of raw numbers, while the Northeast still has fewer in terms of cases, but being a smaller area, it shows that it has a high, by population, it's still more than the Midwest in its falling numbers there. Hospitalizations are following a similar trend with the West and the Northeast now passing the Midwest for hospitalizations per million people. Now, of course, hospital beds are not evenly divided by million people across these regions, so that it will not show us exactly how strained these hospital systems are. As you can see from the peak in the Northeast, we at least have certainly a way to go, but every region in the country has more people in hospitals than they did during the summer peak when the South was hit especially hard. So that's especially troubling there. Now, there are, if it's 12 or 13 states here that have passed 300 hospitalizations per million people. These are individual states, not regions. And this graph shows how those hospitalizations changed over time. Of course, the pandemic, and you can see that there are some states that have been significantly hit multiple times. There are some that were in the first wave, like New Jersey and Connecticut, that are now starting to rise back up, maybe not quite to their highest peaks, but still crossing that 300 people per million hospitalized. And there are some areas that even have seen multiple peaks, like Louisiana, as you can see, has hit that peak 3 separate times. And of course, all these states definitely appear to still be trending upwards. So that is very worrying right now. And in terms of deaths, just looking at the deaths by month, so far December, which we are only 2.5 weeks into December, is the second deadliest month in the pandemic. So we could easily be on track to blow past the numbers from April, which was formerly the deadliest time of this year. So we'll be able to look back at that shortly, and just given the rate, considering how far we've gotten in 17 days, we could easily be crossing that by Christmas. Now let's look at some developments because we've got some better things here. So first up, vaccine rollout. The Pfizer vaccine is continuing across the country. There are some surprises and some hiccups. There are a couple on the more unfortunate side. There's been some delays in the second shipment of vaccines going out to hospitals. It seems to be some kind of logistical issue. Pfizer says it has the vaccines all ready to go and the hospitals are waiting, but there just seems to be some coordination issue with that. On the positive side, it turns out that a lot of the vials of the actual vaccine, which are supposed to contain 5 doses, are actually containing 6 or 7. So that's a little bit of a Hanukkah miracle for you there. And so there's a couple more people getting vaccinated from that. Also, there have been 2 more reports of allergic reactions to the Pfizer vaccine. These were both reported in healthcare workers in Alaska. And so there's still not a lot of information on this. We don't want anyone to jump the gun on thinking that there's a widespread allergic reaction to this vaccine. Given that these are all in healthcare workers, and of course, healthcare workers are the majority of people getting these right now, it would not be surprising if there was some latex issue there in some portion of the storage or transit or the bottle there. Healthcare workers are exceptionally at risk for latex allergies. Also, remember, this is 4 total vaccine allergic reactions in the tens, if not hundreds of thousands of vaccines that are being rolled out across the world right now. It's also perhaps worth noting that since there were 2 in England and 2 in Alaska, these are very grouped for these to be going out. There may be something about specific batches rather than the vaccine as a whole. We'll get a little bit more data on that shortly, however, when the Moderna vaccine rolls out. Yesterday, it received its recommendation for approval by an independent panel of experts for the FDA. And the FDA is expected to make a judgment on that as early as this afternoon. So we may have a second vaccine approved by the end of the day today. So this is very exciting for a number of reasons. The Moderna vaccine, besides just being extra vaccine out there, it's also a lot more shelf stable than the Pfizer vaccine. And that's super important for distribution because the Pfizer vaccine, once out of the freezer, really has to be used up that day, while the Moderna vaccine can stick in a regular refrigerator for almost a week. So that's huge for getting it to places that are not as equipped as the biggest hospitals in the country. Also, speaking back to the allergy point, when the Moderna vaccine rolls out, if we see no allergic reactions to that, then we can adjust accordingly, either whether it's just making sure that people who have history of allergic reactions get the Moderna vaccine, or if it just helps us isolate what the actual reason for those 4 cases was. So the vaccine front, just yesterday, the Vice President, the Second Lady, and the Surgeon General all received vaccine publicly as part of an effort to demonstrate the vaccine safety and help resist vaccine hesitancy. So all 3 have received the first dose of the Pfizer vaccine. You can watch the video live if you want to see them. There's some pretty good injection technique there. And it's kind of adorable how nervous the doctor who is giving the Vice President the vaccine is. Okay, and for the stats and trends, we get our data from the COVID Tracking Project, New York Times, and mass.gov. For more for the MassSupport Network, you can find us on our website or on social media. And remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.